Greetings to you all, our valuable audience. My name is Aisha Adam and I will be your anchor throughout these health and safety issues. And now to the news. Health and safety issues, tackling the cholera outbreak in Sudan. The comprehensive response overview. Sudan is currently facing a severe cholera outbreak, prompting significant health interventions by local and international bodies to control its spread and mitigate the impact on the population. Causes and spread. Cholera, an infectious disease caused by the Vibrio cholerae bacterium, spreads primarily through contaminated water and food. It can cause severe diarrhea and dehydration and can be fatal if not treated promptly. The outbreak in Sudan has been attributed to deteriorating sanitary conditions and the disruption of water supplies in many areas, compounded by the ongoing conflicts that have plagued the region. Government and international response. The Sudanese Health Ministry, with support from international health organizations, has launched urgent interventions aimed at containing the outbreak. These measures include 1. Water sanitation, chlorination of water sources and distribution of water purification tablets to at-risk populations to prevent further spread of the bacterium. 2. Public health campaigns, extensive campaigns to educate the public on proper hygiene practices and the importance of using clean water. 3. Medical assistance, deployment of medical teams to set up treatment centers equipped with oral rehydration solutions and antibiotics, crucial for treating cholera symptoms. Challenges. Despite these efforts, the health infrastructure in Sudan faces several challenges. Funding shortages. There is a critical need for more financial support to sustain the response efforts, especially in remote and conflict-affected areas. Access issues, ongoing conflicts and security issues significantly hinder the ability to reach all affected areas, making it difficult to effectively implement health interventions. Public awareness, misinformation and lack of awareness about cholera prevention and treatment methods among the population further complicate efforts to control the outbreak. Conclusion. The cholera outbreak in Sudan is a public health crisis that requires a coordinated response from both national authorities and the international community. By improving water quality, enhancing public health education, and ensuring adequate medical supplies, there is a hope to control the outbreak and prevent further loss of life. Continued support and attention to the region's political and social challenges are also critical for long-term solutions to health crises like this. For more detailed updates and ways to help, consider visiting health-focused NGOs active in Sudan or following the latest reports from international health organizations engaged in the crisis. Also visit our YouTube channel for the health issue coverages. And now we shift our focus into same matter but in Kenya. Addressing the cholera outbreak in Kenya, urgent actions and strategies. Introduction. Recently, Kenya has also reported cases of cholera, triggering alarm across health sectors and prompting immediate action to prevent a wide-scale health crisis similar to neighboring regions like Sudan. The outbreak's impact. Cholera, caused by the bacteria Vibrio cholerae, results in severe dehydration and diarrhea if untreated and can spread rapidly, especially in areas with poor sanitation and water systems. The onset of this outbreak has raised significant concerns among public health officials in Kenya due to the potential for a fast spread among communities. Response and prevention efforts. The Kenyan government, along with international partners, has initiated several critical steps to address and control the outbreak. 1. Public health interventions. There has been an immediate increase in public health education campaigns. These campaigns focus on hygiene practices, such as frequent handwashing with soap and the safe preparation of food. 2. Water sanitation programs. Efforts to provide clean water supplies are being intensified, with chlorination of public water sources and distribution of water purifiers to vulnerable communities to prevent the disease's spread. 3. Healthcare mobilization. Rapid response teams have been dispatched to set up cholera treatment centers in affected areas, providing rehydration solutions and antibiotics to treat the infected population. Challenges faced. The response teams in Kenya face numerous obstacles, including resource limitations. There is an urgent need for more resources to cope with the outbreak, including medical supplies and personnel. Infrastructure issues. Inadequate infrastructure hampers effective intervention, especially in rural and underserved areas. Community outreach. There is also the challenge of reaching all segments of the population with health education and treatment options, particularly in regions with limited access to media and healthcare facilities. Conclusion: the cholera outbreak in Kenya calls for a concerted effort by both local and international bodies to control the spread and prevent a health disaster. Ongoing efforts to improve water quality, enhance community health practices, and provide medical care are essential to manage and eventually overcome this public health challenge. For further details and continuous updates on the cholera outbreak in Kenya, you can visit our YouTube channel also for other health-related resources. And now we shift our focus to another matter about safety in South Africa: escalating gang violence in Westbury, South Africa. A deep dive into community concerns. Introduction: Westbury, a neighborhood in South Africa, is currently experiencing a surge in gang violence that has heightened security concerns among its residents. This increasing unrest is causing significant distress in the community as they face the consequences of these violent confrontations daily. The situation: the recent uptick in gang violence in Westbury involves multiple shootings and other violent encounters, reportedly connected to disputes between rival gangs. Over a recent weekend, more than 10 people were shot in various incidents, indicating a severe escalation in gang-related activities. Government and police response: in response to the crisis, local police and security forces have been mobilized to address the violence. Increased patrols: there has been a noticeable increase in the police presence in the area, with patrols intended to deter further gang activities. Community policing initiatives: efforts to engage the community in policing activities have been intensified to build trust and gather intelligence on gang operations, investigations, and arrests. Authorities are also focusing on investigating ongoing cases and have made several arrests aimed at dismantling gang networks. Challenges faced: despite these efforts, the community continues to face challenges of fear and insecurity. The constant threat of violence has left many residents feeling unsafe in their own homes. Economic impact: the violence has also affected local businesses, some of which have been forced to close early or have suffered damage from the skirmishes. Community relations: the situation has strained relations between community members and law enforcement, with some residents skeptical about the effectiveness of police actions. Conclusion: the situation in Westbury is a complex issue that requires a multifaceted approach combining law enforcement, community engagement, and social services to effectively combat the rise in gang violence and restore safety to the area. The ongoing efforts by the police to stabilize the community are critical, but long-term solutions will need to address the underlying social and economic issues contributing to gang activity. For more detailed coverage and updates on the situation in Westbury, you can check the reports on our YouTube channel. And now our news segment about health and safety has come to its ending for now. Thanks for tuning into our YouTube channel about Africa. Please do subscribe to our and yours information channel.